Dr. Jeff here with you, co-op student Hannah, this week. This week we're going to talk about cortisone injections. So why would anyone want to get a cortisone injection?
So cortisone injections are a type of steroid. They're an anti-inflammatory that are used to treat anything that ends with itis. So arthritis, tendinitis, bursitis, just kind of helps relieve some of that inflammation, which ultimately helps relieve the pain.
Yeah, so a steroid is they say it's a very powerful anti-inflammatory that they can inject into a joint or a bursa or whatever is causing you the issue. It reduces the inflammation very quickly. It can last, it can be magic and your problem goes away and never comes back again. It can do nothing because they miss it or it just doesn't work. It can last 3 or 4 days. So it's kind of a crapshoot as to how long a cortisone injection will last. But it can be quite magical.
So there are a lot of negative side effects to a cortisone injection. One being if you are diabetic, it does raise your blood sugar levels, so you want to make sure that you are stable before you get the injection. It does also raise your blood pressure, as well as weaken your immune system. Another thing, it could lead to osteoporosis and weaken the cartilage and tendons around that joint. It may also lead to liver damage and fluid retention.
So when it comes to how often can you get a cortisone injection is a question that I get asked quite often. And there's kind of two extremes here. One side says 2 or 3 times in your lifetime is enough because of the side effects that occur. Then you get some orthopedic surgeons, or the other side, some other people saying you get it up to 3 times a year. And again, you just space it out every 4 months because of the side effects that occur. One thing they're doing now is they're kind of limiting how many times you can get a cortisone injection in your knee or your hip or any joint, because what they are finding is that cortisone is actually a tissue destroyer. So it weakens the tissue. So now they're finding, as Hannah said, it weakens the cartilage and things. So it actually leads to early arthritis and leads to joint replacement. So now they're kind of looking at giving cortisone to these people only because they know down the road they're going to have to get a new knee or a new hip. So with the cortisone injection, there's certainly positives with it and there are negatives with it. So you really have to weigh the pros and cons as to getting a cortisone injection. A lot of times now you'll find people that are doing cortisone injections are using laser or ultrasound guided cortisone injections. So they're actually using an ultrasound, much like what you'll use with a fetus, so they can actually see the needle going in to make sure they're hitting the proper spot, because if they don't hit the proper spot, it's really not going to work very well. You'll still get all the side effects to it, but it's really not going to work very well. There is an alternative to getting cortisone. It's called a PRP injection, plasma-rich platelet injection. What they do is they take your blood and they spin it, and they take the platelets, they re-inject that with other growth factors and things into the joint. The whole idea with that is the stem cells or the platelets will regenerate as that tissue, so it will regrow your cartilage or regrow your bone. So PRP is known as a tissue producing injection, whereas cortisone is known as a tissue destroying injection. PRP does not have the anti-inflammatory properties that cortisone has, and it can take 3 to 6 months for you to find the benefit from a PRP injection, whereas cortisone you can feel almost instantaneously if it's going to work. But there is alternatives now to getting a cortisone injection. So if you have any questions about what we talked about today with cortisone injections, you can always email us at jgoldsworthy@goldsworthywealth.com, or you can talk to us on Facebook.
If you liked the video, be sure to give it a big thumbs up and share it with your friends. As always, I'm Hannah, here with Dr. Jeff.
And we've got your back.